Well, thanks very much. It's a pleasure to be here. And I know this is a topic that's of wide interest and has some emotional component to it as well. So I look forward to talking to you about this. And the questions that I'm hoping to answer today are, first of all, how does aging affect driving? Secondly, how do you know when it's time to retire from driving? Third, what to do after driving retirement? And lastly, and most importantly, what can be done to prolong driving? So I hope to answer these questions. And we'll start with, how does aging affect driving? And why are we talking about this? So in California, there were 4.5 million residents over 65, and that's growing. The population over 65 is the largest growing population at this time, the biggest demographic that's increasing. And by 2030, 1 in 5 licensed drivers in California will be age 65 and older. And that's thanks to us baby boomers. You can see that in 1950, we were starting to change the demographics of the United States, and by 2000, we had reached middle-aged, and now the baby boomers are retiring, and every day 10,000 baby boomers are retiring and reaching the age of 65. So we're having an impact not just on the roads, but on other aspects of life in America. And for this reason, we need to encourage our kids and our grandkids to get out there and get jobs to support us, right? So where do older adults reside? Well, most of them reside where they've been living for a long time, and 6 out of 10 older individuals age in place. We don't necessarily think about our transportation needs when we think about where we're living. And driving means a lot to us. It's our mobility and freedom, but it's also our self-expression and the kind of car we choose and how we choose to get around, as often says a lot about us. So it's really close to our hearts, our means of transportation. And when we look at how people are getting around, well, it's obvious that the 65 to 74-year-old group are mostly driving themselves, but look at the 85 plus group. Even that group, more than 50% of people are driving themselves as the way to get around. Now, some people say, well, I'm going to self-regulate and I'm only going to go out when the traffic's light. But the evidence is that that's going to get harder and harder to do, because we're anticipating by 2030 that there's going to be a 1/3 increase in vehicle trips and almost a 50% increase in the number of miles traveled. So it's going to be harder and harder to find a time when we can get out there when the traffic's light. So I like to think that as I've aged, I've accumulated some good characteristics, and that these strengths translate into better driving. It's true that as we age, we tend to take fewer risks. I always thought I was pretty compliant with the law, but apparently the studies say that as we age, we follow the rules very well. And we have some life experiences that hopefully translate to improved driving as well. But there are some medical conditions that we tend to accumulate with aging. Now, I want to say that having these medical conditions at any age would have an impact on driving. It's just they're more common in older individuals, and they tend to be clumped into reduced vision, cognitive impairment, decreased strength and mobility, or otherwise frailty, and other medical conditions and medications that we can talk about. So let's talk about vision first. Well, when we're younger and we have vision problems, mostly we can go to our friendly ophthalmologist and they'll correct our vision pretty close to 20/20. But as we age, sometimes we accumulate vision problems from things like macular degeneration that can't be corrected. And in fact, 1/4 of people over the age of 80 have vision problems that can't be corrected to 20/20. And this is what the world looks like to somebody with 2200 vision, not very compatible with safe driving. And the other problem is not just visual acuity, but visual fields. So again, having problems with visual fields isn't something that happens very often in younger individuals, but as we age, some eye problems can predispose to these visual field problems, being able to see to the side. And you can imagine if you're having trouble with your peripheral vision, that being able to see pedestrians or bicyclists or cars coming next to you is a problem, getting through intersections and so on. And this is what the world looks like to somebody with visual field problems. On the left, you can see somebody that just has a problem on one side, whereas on the right, that individual has a visual field deficit on both sides. Cataracts are the leading cause of blindness around the world, but not in the United States, because most of us go and get our cataracts fixed. Now, we don't always do this in a timely manner. My mother's been putting this off for years and having a little bit of trouble seeing right now. So the world to somebody with cataracts starts to look pretty cloudy and their visual acuity is impaired. The other bad news I have for you is that as we age, our contrast sensitivity goes down. So even without any eye disease, we can't see the difference between light and dark very well. And you may have noticed that either you or your significant other need brighter light in order to be able to see, in order to be able to read, even with glasses on that bring your vision to 20/20. And you can see on the difference between the left and the right that that's quite a difference. In fog or dawn or dusk, that's going to be even more pronounced. So this is what it looks like to somebody with macular degeneration. It affects the central part of the vision, so it affects visual acuity, and unfortunately that impairment, that visual impairment's right in the middle of the visual screen. Glaucoma is a disease that affects visual fields, and this is somebody who has a visual field deficit on both sides. Diabetes is the leading cause of blindness in the United States. Not only can it cause retinopathy from the diabetes itself, but it also predisposes to the other things I was talking about, like cataracts and glaucoma. Now, the good news is that if you have diabetes and take really good care of yourself, keep your sugars under control, watch your diet, take your medication, see your ophthalmologist, a lot of that problems with the eyes can be avoided. So the next area is frailty. And aging can affect motor function due to reduced muscle mass, osteoporosis, and diseases such as arthritis. Now, I know all of us in this room weigh exactly the same as we weighed when we were 18 years old, right? Well, even though we've managed to maintain that weight, unless we've worked very hard, we've reduced our muscle mass. So the percent of our body weight that's muscle has gone down. And that's known as sarcopenia, and because of that, we have reduced muscle strength, as well as osteoporosis or thin bones. So that, you'd say, well, what does that have to do with driving? If I can get myself into the car, can't I drive safely? But there's been a number of studies that have found that just being frail is associated with an increased crash risk. And the other problem is that people who are older and frail are often driving with passengers who have similar problems. And I'm going to show you some data on why that's not just a problem for crash risk, but what happens after the crash. And this is some of the studies that have shown that having frailty is associated with driving problems. So that brings us to what I like to call DUID, or driving under the influence of dementia. Cognitive impairment is often underdiagnosed. I've been in practice for 32 years now, and one thing that happens if you stay in the same practice is you get old with your patients. And I've been asking my patients the same questions for 32 years. They are really good at those questions. So unless I specifically look for dementia in my patients, I'm going to miss it, just like their family members are going to miss it. And in fact, studies have found that 1/4 to 3/4 of dementia patients aren't picked up by their primary care docs because they haven't specifically looked for that. And another study found that 25% of elderly patients without signs of cognitive impairment actually failed screens in primary care settings. So my message to docs, we do a lot of physician training, is that you have to systematically look for cognitive impairment or you're going to miss it. Now, if you've been coming to these lectures, you probably know a lot about dementia. And dementia is just a general term for loss of cognitive function that has multiple causes, Alzheimer's being the most common, but there are other diseases that can cause cognitive impairment or dementia. Because dementia causes confusion and diminished memory, problems with executive function and personality changes, that can be a problem for driving. So people with mild dementia may be able to keep driving. It's very variable, and it depends on the function of that individual. They may only have mild forgetfulness or some subtle disorientation, but as dementia progresses and becomes moderate or severe, people are more impaired and they shouldn't be driving. Sometimes they are, but they shouldn't get behind the wheel of a car. Driving with dementia can lead to things like forgetting where your car are, getting lost while driving, but also increase the chance of getting into a crash and so on. Other medical conditions are also associated with bad driving outcomes. Parkinson's disease can affect both frailty as well as dementia. Epilepsy, of course, not a good idea to drive if you have epilepsy and it's not controlled. And other respiratory and cardiovascular diseases that may affect blood flow to the brain are associated with driving debacles. Strokes can be a problem. Again, people can have strokes and recover from them and do very well with driving, but it's individual. And then commonly metabolic conditions. So people who have diabetes and have recurrent episodes of hypoglycemia can get into trouble when they're driving because they may become confused or even lose consciousness, but people whose diabetes is well controlled and who don't have those problems can do fine. Now, we've been working in the area of older driver safety for about 7 years, and unfortunately, we have had no trouble finding these stories in the news. These are just some of the examples that we found, and some of them end very tragically. The problem with medical conditions and driving are numerous. One of the major problems with older drivers especially is problems with turning left, because it's such a complex decision making involved in turning left, trying to figure out how fast the oncoming vehicles are going and so on. Also pedal misapplication, there's been a lot in the news about that. And one of the theories about that is problems with sensation in the feet, maybe some peripheral neuropathy due to diabetes that makes it difficult to tell which pedal somebody has their foot on. Now, this slide is to let you know that injuries are a very important component of morbidity and mortality in this country, and I feel rather underrepresented. Until age 45, injuries are the leading cause of death. And it's not that after age 45 that they become less important, it's just we tend to accumulate other problems. And you can see that there's this decade, 65 to 74, where the raw numbers of injury deaths temporarily go down, where humans seem to have this decade of reduced risk-taking and maturity, and then we start falling, and the injuries go up again. And if we look at motor vehicle deaths, you can see that it's also continues to be a problem, whereas we might not have quite as many motor vehicle deaths over age 65, it's still very significant. So paying attention to how we can reduce injuries and deaths from injury is particularly, continues to be important. And I want to show you some of the data. Now this looks at men and women and the number of miles driven on average per year. And you can see that throughout life, men drive more than women. And that explains some of the data I'm going to show you, but not all of it. When we look at fatalities per mile driven with age, after about age 70, the graph starts to go up. And by age 80, we're looking as bad as teenagers. Now, at this point, you can see that the men and women are almost the same over age 70. But when you take into account the fact that women don't drive as much as men, and if you look at driving fatalities per million population, the men start looking really bad. And if you look here, you can see that men over age 70 aren't making real good decisions about driving, and they're looking as bad as the teenage boys down here. Now, I told you that in this decade, 65 to 75, we humans seem to have this temporary maturity that's taking place. However, there's still this large gap between men and women, and I call that the gender maturity gap. Women, I think you know what I'm talking about. It never goes away. This is just another way of looking at the same thing, both men and women combined, looking at fatal crashes per million miles traveled by age. Now, the other aspect of it is, so what happens to people? People are more likely to have crashes, and what happens to them in terms of frailty. So what I want to show you here is that for a crash of the same intensity, your average 20-year-old male is 1/4 less likely to die than a crash of your average 70-year-old male. And it's the same for women. So older drivers are more likely to get in a crash, and when they do get in a crash, they're more likely to be injured. Well, why is that? Well, we talked about frailty, sarcopenia, having reduced muscle mass, osteoporosis, having thin bones, and then what we in medicine call comorbidities. All of those things that are on your problem list when you go to the doctor and they never get taken off, right? Hypertension, diabetes, all of the various illnesses that we tend to accumulate as we age. So this is one woman saying to the other, my arthritis is so bad I can't grip anything, my cataracts are worse every day and I can't hear a thing. And her friend says, that's terrible. She says, thank goodness I can still drive. So this is what we don't want to happen. This is the excuse me driver. Managed to get through the intersection. So how do we know when it's time to quit driving? This is the next section. Now, on average, men outlive their driving abilities by 7 years and women by 10 years. We hope to outlive our driving abilities, right? And in a 2001 study by the Rancho Bernardo group, of which we have representation here, 6% of 65 to 74-year-olds retired, 33% of 75 to 84-year-olds, and 61% of 85-year-olds. But I said, we don't want to have to set an age where people retire. Everybody has a different biological age than their actual age, and we've all got accumulating diseases at a different rate. And young people can have diseases that are incompatible with driving as well. So how do we know when it's time to quit driving? Well, the AMA has given physicians some guidance in that regard. And they came out with a guide that's available online, so if your doc doesn't know about it, you can direct them to this. And they said, let's test people for 7 studies that address the issues I just talked about. So the first is visual fields. It can easily be done in the office. The second is visual acuity, which can be done on a wall chart or some other way. And then there are 3 tests for frailty. So the first is the rapid pace walk. You ask people to walk 10 feet and back and see if they can do it in 9 seconds. If you can't do it in 9 seconds, the AMA considers that that's a significant sign of frailty and that driving retirement should be considered while looking at the other data. The other things that we look for in frailty are range of motion. So can you turn your head? When you drive, you have to be able to look over your shoulder, make a fist, and so on. And then motor strength, looking and seeing if the muscles of interest are still strong enough. So I said that the frailty is associated with the outcomes that we care about, which are citations, crashes, injuries, and death associated with driving. Nobody's done the study to say, do you need to see to drive? I guess nobody's been able to convince the NIH that that study needed to be done. So we're just going to assume that that's a good thing. The next two tests are related to screening for dementia. And these are nice tests. They can be done in the office, and they're screening tests. The first test is clock drawing. I ask my patients to draw a clock like a child would, put the numbers inside, and set the time to 10 minutes after 11. The study was standardized to that time. So this is what you want your clock to look like. I had my mother draw this when she was 78, 5 years ago. She won't let me near her with a pen and paper anymore. That's what you want it to look like, though. And these are some of the clocks that we got when we did a study at UCSD with volunteer drivers who had been admitted to the hospital. And as a physician, if my patients draw a clock that looks like this, I'm going to be concerned. Clock drawing's not diagnostic of dementia, it's just a screening test, but that's one of the things that the AMA recommends. And in fact, the studies have been done looking at the relationship between clock drawing and driving. And trail making is the other one. It does require near vision, and the person has to make logical connections from one number to another. So you ask people to alternate numbers and letters and connect the dots like this. If the person makes a mistake, you stop them, but you don't stop the clock. Trail making is graded by seeing if the person can finish it in less than 180 seconds. And again, it's just a screening test for dementia, and other workup needs to be done. But it's got a good sensitivity and specificity, which means it doesn't have a lot of false positives or false negatives. And these were some of the trail makings that we got, again, in our volunteer drivers who had been admitted to UCSD, who had very long trail making testing done. The nice thing about trail making is it's a continuum, and you can distinguish between completely normal controls and people with mild cognitive impairment and people with Alzheimer's dementia. And again, trail making has been associated with crash risk, so it's nice to have a test for dementia that's actually associated with the outcomes that we care about in this regard. In our experience at UCSD with 815 volunteers, we found that 6% of them failed our testing due to vision or frailty, and 11% failed due to cognitive impairment. Many of the hospitalists weren't aware that people were having problems that could impair their driving, and so one of the lessons that we learned from that is at the time that people are admitted to the hospital, they may be undergoing some perhaps temporary but acute changes to their health, and that not driving until they see their primary is probably a prudent thing to do. So what about your aging family member that you're worried about and perhaps they're not worried about it? How would you know if they were having driving impairment? So one thing you could do is have them go see their physician and have that testing done, or you can go for a ride with them and see if that scares you. The other thing you can do is to do a visual inspection of their car and see if there are a lot of unexpected scrapes and bumps on it. Or look inside the car and see if there are notes or reminders that they've put in the car to themselves, like, this is the steering wheel. So there's been some studies on who wants to hear about their driving skills, and some of the studies found that married individuals preferred to discuss driving with their spouse or an adult child, with physicians coming next, but that single older adults preferred discussing driving with a physician, followed by adult children if they had them. We view this older driving issue as interdisciplinary. It's not just one person's problem. Law enforcement's also involved. Sometimes we've been working with the California Highway Patrol, trying to train them to identify people who are having medical problems when they drive, including dementia, and letting the DMV know that these people are having problems so that they don't continue driving and get into trouble. In terms of physicians, we have the opportunity to refer people to the DMV if we're worried about them. And in fact, we are mandated reporters. So there are many diseases that I'm obliged to report to the public health, but one thing that we found physicians weren't always aware of is that we're also obliged to report lapses of consciousness, and dementia comes under that category, as do losses of consciousness. And this is mainly because of the driving risk involved in those things. As I said, some people with mild dementia can continue driving, but the DMV wants to know who they are because dementia is a progressive disease. Also, the DMV is involved, and those states that require in-person renewals of their license have 17% less older driver fatalities. And from an epidemiologic point of view, that is really significant for a fairly minor intervention. One little known fact is that California is the only state that has a senior driver ombudsman, and this individual helps people negotiate through the DMV. It helps people keep driving longer if that's appropriate for them. All right, what happens after driving retirement? Well, unfortunately, studies have found that good things don't happen after driving retirement. Unless you're really careful, you can become more isolated. And so I'm here to tell you that if you're forewarned is forearmed. So even trips to the doctor went down after driving retirement. So, and what about trips with family and friends? Those went down 65%. Well, science has finally figured out that friends are important. And so one of the things that we want to do is stay with social networks. It turns out that our physical and mental health depends on it. So if you do end up with driving retirement, try to avoid isolation, find alternative means of transportation, maintain those social networks. They're really important. Consider relocating to a walking community. Try to look on the positives. One of the good things about driving is it avoids legal problems, crashes and injuries. There's less stress from traffic and vehicle maintenance. And the estimates are that it costs us $5,000 a year to drive a car by the time we do our insurance, our gas, our maintenance, even washing the car, depreciation, all of that. Well, $5,000 goes a long way towards finding alternative means of transportation. And we are getting better in this country. I know we have a long way to go, but there are a number of alternatives. And Ride Fact can provide some guidance of that, and we've given you that resource as well. There's also resources for families that's been provided by Hartford and AARP. So that brings us to the important topic of how to prolong driving. And I wanted to point out here that this Canadian 85-year-old just finished a marathon. Guess how fast he ran that marathon? 3.5 hours. 3.5 hours, fastest in his age group. I would say, you know, he's probably fastest in a lot of age groups. So my message, how to prolong driving, is to stay fit and to try to stay healthy. I was in Los Angeles giving a talk with AAA, and this man came up to me and said, I'd like to talk to you about that sarcopenia. You said, you know, it's almost inevitable that people lose their muscle mass as they age. He said, I've been doing martial arts for 50 years. Feel my biceps. I can bench press anybody in my neighborhood. My wife says, don't humiliate the younger guys. So how do you extend your driving career? Well, first of all, talk to your physician. If you're having some arthritis, what can you do about it? Do you need PT to improve your muscle strength? How can you get off medications that you don't need? Taking a driving refreshing course. So let's go through some of those. We know that there's a lot of medications that affect driving. I mean, if ever you've pulled a muscle and somebody's given you a muscle relaxant, you know what that makes you feel like, or you've had some dizziness and you get Antivert or Meclizine, one of those drugs, it makes you drowsy and ditzy, really interferes with your driving. Well, talk to your physician about looking at your meds list. What can you get off? How can you avoid those medications? We know that those medications interfere with reaction time, might cause some muscle weakness, lack of attention, confusion, and drowsiness. And AAA has something called Roadwise Rx, where you can enter your medication and they'll tell you how those medications affects your driving. There are risk factors for dementia that are modifiable. If you have hypertension, keep it under control. Staying physically active, keeping your cholesterol under control, avoiding head injuries. I mean, this is one thing I worry about with some of the sports that the younger ones are involved in, is that they're putting themselves at risk. But we can also protect our heads. And if you do drink wine, you can feel okay about it. I'm not going to tell you to drink wine, but if you do, it's probably not a bad thing from a dementia point of view.
What are our numbers?
I'm sorry, relative risk. So if the relative risk is less than 1, then it's protective, and it's greater than 1, then it's harmful. Now, I don't know if anybody's ever told you, but it turns out that smoking's not very good for your health. Well, from a dementia point of view, smoking's not good either. And you can see that the risk goes up when you smoke. Staying in school and having a lot of education is protective. So no talk on driving is complete without talking about alcohol, because unfortunately, alcohol is the leading risk factor for fatal crashes. And unfortunately, 15% of fatal crashes that involve alcohol are older drivers. As we age, we're less able to metabolize alcohol, and whereas abstinence should be the message for everybody, because we're talking about older drivers and driving safety, I'm here to tell you that if you do go out, that you should abstain from alcohol if you're the driver. We used to have a rule with our kids when they were teenagers that if they went out to a party and they wanted to call us because maybe they didn't feel safe driving home, we'd pick them up. Well, maybe you can make that arrangement with your own children now. If I'm going out and partying and I end up with too much to drink, can I call you to come rescue me? Now, I don't know if you can see this, but not only is this woman on the phone, but she's reading while she's driving. So that brings us to the problem of distracted driving, which I'm thinking of as the new secondhand smoke. I mean, it is so prevalent out there, and it's having an effect on our health. Everybody else's distracted driving is affecting us. So my message is there is no safe way to distracted drive. You're going to say, well, can't I do hands-free? That's legal. As far as we know, the data's still coming in, but as far as we know, it's no safer than hands held, and it's the same as driving with a blood alcohol concentration of 0.08, which is the legal limit. We just did a study of 5,000 college students, and unfortunately it confirmed what we had suspected, which is that they're out there distracted driving. 78% of them said that they're on the phone, and 50% of them said that they're texting while driving full speed down the freeway. So my message to you is don't be a distracted driver, and try to spread that message around. We have an influence on our friends and family. We can make contracts with our teenage children or grandchildren that distracted driving is just not acceptable. I put that on my message of my phone, that if you call me and I'm in the car, I'm not going to pick up. And that's the way that we change social norms, is by letting other people know that that's not acceptable. So the other issue is self-regulation. If the traffic conditions or the weather are such that you don't feel safe going out, cancel that trip. So again, I know this is going to come as a huge shock to the women in the audience, but there was a study done looking at 250 men and women who were posed a hypothetical question: what would you do if you had to go on a road trip and the weather suddenly turned very bad? And 17-1, the women said we would not go on the trip. So self-regulation is important. You know, be aware of your limitations. There's a lot of technologies that are coming out that are specifically targeting older drivers, and they include smart headlights that go between regular and bright depending. You don't even have to think about it anymore. My favorite one is the car that parallel parks for you. So these are out there. Whether they're going to make us be able to prolong our driving careers or not remains to be seen. I don't think the study's been done, but certainly the car manufacturers are working on this technology. The other best kept secret are occupational therapists who can help us with our driving, trying to figure out if we're still able to drive, and also help us with our driving skills. So the occupational therapist generalists can do the kinds of testing that the physician can do according to the AMA studies. And they can also help equip our car with things that will assist us if we're having some physical problems. But there's also the OT driving rehab specialist. And they can be not only part of an assessment, but they can be part of the solution. So if you're not sure if your own driving has reached the point where perhaps you should think of retirement, or you're having a discussion with a family member on whether their driving skills have reached that point, a driving rehab specialist can take people out on the road and provide an objective opinion about this. But they can also help people prolong their driving. So perhaps if somebody's had a stroke but they're recovering and they want to learn to accommodate for that problem, the driving rehab specialist can take them out and train them, give them extra mirrors, and so on. So where would you find such a person? Well, you can find them online. We've included them in your resources, and there's 3 places in San Diego that provide this: Scripps, Sharp, and Tri-City. They're really a very good resource. AAA has something called Roadwise Review that you can do in the comfort of your own home. It's all computer-based, and it gives you some feedback on your driving skill. And then there's driving improvement training, AARP. There's a program called I Drive Safely and a program called Lifelong Driver, all of which are hoping to help people keep their driving skills up. I mean, certainly, you know, the last time any of us took driver education was when we were teenagers, and it's getting to be longer and longer ago. So this is what we want to do. We want to stay fit, and we want to stay active, and those are the main things that we can do to prolong our driving career. I'd be happy to answer your questions by email, or you can visit our website. Thank you very much.